Dear viewers, I hope you are all fine. This ultrasound video shows two cases of cervical mass. A cervical mass or polyp is a growth that develops on the cervix, which is the canal connecting the uterus to the vagina. Cervical polyps are tumors, but they are usually non-cancerous or benign. Now, the common symptoms of a tumor that develops in the cervix may include vaginal bleeding, including bleeding between the periods after sexual intercourse or post-menopausal bleedings, unusual vaginal discharge, which may be watery, pink, or foul smelling, and pelvic pain. You can see the mass in the cervix attached to the interior wall of the uterus. Mostly the masses on the cervix are benign and non-cancerous growth such as polyps or cysts. In some cases, however, they may indicate the presence of cervical cancer. It may be discovered during a routine pelvic examination or pap smear test. Most of the women early cervical cancer has no symptoms. Symptoms that may occur include abnormal vaginal bleeding between the periods after intercourse or after menopause, vaginal discharge that doesn't stop and may be pale, watery, pink, brown, bloody, or foul smelling. Most women with the HPV, that is human papilloma virus, would not get cervical cancer. The virus often resolves on its own in 2 years or less without any treatment. However, some people may continue to be infected long after exposure. HPV and early cervical cancer doesn't always cause symptoms. Cervical cancer is often curable if it is diagnosed at an early stage. When cervical cancer is not curable, it is often possible to slow its progression, prolong lifespan, and relieve any associated symptoms such as pain and vaginal bleeding. This is known as palliative care. Cervical cancer is often can affect the deeper tissues of the cervix and may spread to the other parts of the body, that is metastasis, often the lungs, liver, bladder, vagina, and rectum. In the early stages, cervical cancers or cervical cancers cause no pain or other symptoms. That is why it is vital for the woman to get regular pelvic examination and pap test to detect the cancer in its earliest stage when it is treatable. Pain during intercourse, vaginal discharge, and odor may be the early symptoms, and one should take care the need to get examined by a gynecologist. Now the sign and symptoms of the cervical cancer are blood spots or light bleeding between or following periods, menstrual bleeding that is longer and heavier than usual, bleeding after intercourse, douching or a pelvic examination, increased vaginal discharge, pain during sexual intercourse, bleeding after the menopause, unexplained persistent pelvic and or back pain. Most of the time, early cervical cancer has no symptoms. Symptoms I have already repeated. Now, this cervical cancer examination, the healthcare providers place one finger in the rectum and the other finger in the vagina. This is to feel the tissue between and around these two organs. Some cervical cancers may be found during a pelvic examination. Now, Just after this case, you will see another case of the, now you can see the second case of the cervical mass, and this mass is quite larger, is semi-solid to solid in consistency, and is involving the whole length of the cervix and the proximal portion of the uterus. Now, cervical cancer develops and occurs when the cells of the cervix grow abnormally and invade other tissues and organs of the body. When it is invasive, this cancer affects the deeper tissues of the cervix and may have spread to other parts of the body, that is metastasis, most notably in the lungs, liver, bladder, vagina, and rectum. Now, if the cervical cancer lacks oxygen, some cells may die of infecting the tumor. This infection creates a foul-smelling vaginal discharge, which serves as another sign of the cervical cancer. This continuous discharge may be pale, watery, brown, or mixed with the blood. So now the cervical cancer diagnosis in the blood test, it can indicate the cervical cancer. The heat profile from a person's blood, known as plasma thermogram, can serve as an indicator of the presence or absence of the cervical cancer, including the stage of the cancer. Now you can see another mass in the middle portion of the uterus near the posterior wall. A small mass, this is the larger mass, and this one is a small fibroid seen in the middle portion of the uterus. Now the early warning signs of the cervical cancer. When present, common symptoms of tumors that develop in the cervix may include vaginal discharge, including the bleeding between periods after sexual intercourse, or post-menopausal bleeding, unusual vaginal bleeding, which may be watery, pink, or foul-smelling. You will see some cervical and vaginal discharges depending on where you are in your menstrual cycle. Your cervical fluid may range from pasty white to clear and starchy egg white texture. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.